Okay, is it just me, or was that really satisfying to watch? What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and today we're going to talk about eating in the hospital. So there's 3 different ways to get nutrition in the hospital. The first way is just what you or I do every day, just eating food normally, taking food in by mouth. Another way is with tube feeds, which we'll get into later in the video. And then the third way is actually what you saw in the introduction, total parenteral nutrition, or getting nutrition pumped into the veins through an IV. So let's get right into just eating, normal diet. So when patients come into the hospital in the ER, one of the first orders I'll place is a order for a diet. And if it's somebody who really has no real medical problems and they're here for, let's say, something that doesn't involve the digestive tract, or there's nothing in particular that I'm worried about, maybe they're here with a broken hip or something, I'll just order a regular diet. So that means that the patient can order whatever kind of food he or she wants, pizzas, cheeseburgers, you name it, it's okay to eat. And they can even get food brought in from outside, like delivery, Panda Express or something. I saw that the other day. And so that's all okay, with a regular diet. But let's face it, a lot of people in the hospital, they've got medical problems, sometimes lots of medical problems, kidney disease, heart failure, liver problems. And so it's really not ideal to order just an unrestricted regular diet. So in these cases, I will put some restrictions. So let's say if somebody comes in with congestive heart failure, so their heart's not working well, causing their body to swell up with fluid, I'll order a cardiac diet. And so what that entails is it's low sodium. So reduced sodium usually to 2 grams per day, or sometimes even less. And that can help prevent not only high blood pressure, but also helps to reduce swelling also. And somebody who, let's say, is in the hospital for a heart attack, you might put caffeine restriction, because you don't want anything that's going to make the heart pump harder or faster. Actually, on the contrary, we'll give medications called beta blockers to slow the heart rate down, to relax the heart, so it's not having to work so hard when it's in an acute heart attack. And so those are a couple cardiac restrictions. There's also different diets for kidney failure. So a kidney diet, that would be low in potassium, low in phosphorus. So these are 2 electrolytes that tend to really build up in the body when the kidney is not functioning properly, because we rely on our kidneys to get rid of potassium, get rid of phosphorus. And it can be a real big issue if the potassium goes high. Too high, it can actually cause cardiac arrest. In fact, in lethal injections, that's the way we do capital punishment in my home state, California. That's done with an injection of potassium, which effectually stops the heart. And so you don't want your potassium going too high. So somebody with kidneys that are not functioning well, you do a kidney diet where there's going to be lower potassium in the diet. Let's see, other common diets. I think that's kind of probably the more common ones that I'll order. And there's other things. There's a neutropenic diet too. So this will be trying to avoid raw food. So raw fruits, vegetables, certainly no sushi. You might give this one to somebody with a very compromised immune system. So after chemotherapy can really bring down your white blood cell count, so you can't fight off infections as well. A neutropenic diet would be something to consider in that case. So that covers dietary restrictions, but it's more than that. We also need to get into consistency. So a normal diet, it includes fish, steak, chicken, hard food that you got to chew and swallow. But many people in the hospital, they're not able to do that. And so you can have other modifiers for the diet, such as a soft diet or a pureed diet. So a diet that's ground up and it's kind of like mush that you don't really have to chew. Then there's also liquid diet as well. So more just focusing on soups. And common reasons why you might want to order these would be somebody who had a stroke, for example. After a stroke, it's very common for people to have a hard time controlling the musculature that allows them to swallow food safely. The result of this is that food can sometimes go down the wrong pipe. It can end up in the lungs. This is aspiration. This can lead to pneumonia, and it can even be life-threatening. So it's a really big deal. And so we really rely on professionals called speech therapists or speech and language pathologists who evaluate patients' swallow function and give us recommendations for what kind of diet consistency. And if they can't handle a full diet, we might do a pureed or other modified dietary consistency there. All right, and then I guess the last diet is a clear liquid diet. So this does not look very appetizing to me, but this is, one step even below a liquid diet. We're not even doing soups. Forget about chicken noodle soup here. We're doing mostly just jellos. There's maybe some broth, but it's a very mild diet. You might introduce this to somebody who is going to go for a procedure maybe later in the day. And so you don't want a lot of dense food in the digestive tract. Or, big surgeries, procedures, you actually don't eat anything. You're what they call NPO before. But sometimes, like, for example, if you're going for EGD, that's esophagogastroduodenoscopy. That's where a gastroenterologist looks in the throat with a camera. Before they make you NPO, they usually will recommend a clear liquid diet first to really clear out the digestive tract. For procedures, you might consider clear liquid diets, but also when you're just trying to ease a diet back into somebody, maybe somebody with pancreatitis, they've been nauseous, vomiting, stomachache, really bad, don't feel like eating, you might just barely, when they're just getting started eating, you could ease them in with a clear liquid diet at first. And so that's a very restricted diet. We don't want to stick to that too long. Now, other restrictions too, you got to talk about fluids, right? Speaking of fluids, I'm just going to grab a quick little swig here. My throat's getting kind of dry. So fluids, doctors are always telling you to drink plenty of fluids, drink 8 glasses of water a day, for example. But in the hospital, sometimes you don't want to do that. And actually, we even restrict fluid in certain cases. A big one would be low sodium, so hyponatremia. It can be quite a challenge to treat this. And it's unfortunately a common issue in the hospital is people just, when they get a blood test, their sodium levels are too low. And this can be a big deal. If the sodium drops too far, you can have seizures. You can go into a coma. It can be, something really dangerous. And to treat it, you can't just give salt tablets usually. You can, but the more effective way to deal with this is to focus on the fluid balance in the body. So this would be in the case of low sodium, you want to bring it up. So you want to reduce the amount of fluid in the body. So we'll do fluid restriction or free water restriction, usually to 800 cc's per day. And so that sounds like a lot, right? Like 800 cc's, how many cc's is this? Oh, it's not a lot. This is 568 milliliters. 800 is just like a little more than this for the whole day. And that includes the fluid in your meals. So any fluid that's in the soup you're eating, or with fluid you take in when you're swallowing pills, so it's really pretty restrictive diet when it comes to fluid. But the end result is that it helps to bring up the sodium levels naturally in the body and you overcome the low sodium. That's the mainstay of treatment for what we call SIADH, syndrome of inappropriate antidiuretic hormone, which is one of the common causes of pathologically low sodium within the body. Okay, so that kind of covers all the diet by mouth. Let's jump into tube feeds. So sometimes people just can't take food by mouth. Probably the most common issue I run into is after brain damage, brain bleed, stroke, some other reason where, like we mentioned earlier in the video, you're just not able to control the swallow function, can't swallow safely. So people like this, in this condition, end up relying on tube feeds. So we start for tube feeds with a nasogastric tube. So this is a tube that gets inserted into the nose and it snakes around, goes down the esophagus into the stomach. And I'll tell you, you don't want a doctor doing this, you want a nurse doing it, because I've literally only done that procedure once in my entire life, way back in medical school, whereas nurses do it all the time. They're very proficient with this. And you can do things like numb the area a little bit so it's less uncomfortable, but I think I don't think it's fun to get that tube pushed back there. But then once it's in, it usually doesn't cause a whole lot of discomfort. And then it's really great because then we can administer medications, tube feeds straight into the stomach, bypassing the problem area up here. And there's one problem though. Well, there's a couple problems with this. You can actually oddly enough, increase risk for aspiration with this, even though that's what you're trying to avoid with the tube feeds. But the thing is, now you're pumping feeds into the stomach, and so if the patient starts, getting nauseous and vomiting, there's still going to be tube feeds getting pumped in. So you got to be able to stop that right away. Also, if somebody becomes delirious, which is quite often the case in people recovering from brain injuries, that individual might rip out the nasogastric tube. So that's another problem. And the third issue is that they do cause some irritation to the oral pharynx, the esophagus. For that reason, you don't want to leave them in long term. So usually about 2 weeks or so, that's kind of the cutoff. I mean, you can push it a little bit, but it's not something you want to keep in your body for months and months. So that brings us to the next type of tube feeds, which is feeding through a permanent feeding tube. So this is a gastrostomy tube or a PEG tube. So this is a tube that actually goes directly into the stomach. A procedure is needed. It's like a small surgery to get the tube inserted there. And then it gets so sutured into place. And this is meant to stay long term. So people who we don't anticipate recovery of the ability to take food by mouth, they'll get one of these more permanent feeding tubes in place for that. Okay, and then now into the final way to get nutrition in the hospital. This is what you saw in the intro to the video with that very satisfying popping sound. Total parenteral nutrition, aka TPN. So this just sounds amazing. You're pumping all the proteins, fats, vitamins, minerals, carbohydrates directly into the vein. This is just wonderful. But, it sounds great in theory, but in practice, there's some issues, right? It's very unnatural. Human beings just weren't designed or made to take food in directly into the veins. And so you end up with electrolyte abnormalities. Also, you need this huge IV, a PICC line, to even get the nutrition to begin with. And this PICC line can get infected. You can get clots around it, which can make your arms swell up. So it's got, its own set of problems. And because of that, the mantra in the hospital is usually, if you can take food, if you can use your gastrointestinal tract, use it, either by just eating normally or with tube feeds into the stomach. So really, TPN is made only for instances where you can't use the digestive tract. So you might think, what could that possibly be? Well, one that I encountered recently was somebody with very large gastric tumor causing gastric outlet obstruction. And so here's somebody who really, the food is just not going to pass, even if you're using a feeding tube into the stomach. And so in that case, getting nutrition pumped into the IV into the veins is really your only option. Okay, there you go. There's 3 ways that people get nutrition in the hospital. I hope you enjoyed this video. Thanks for checking it out. And if you like medical content like this, feel free to hit the subscribe button there or check out another video right here. And I'll see you guys next time.